Hi, everyone. Welcome to the Tech Choices and Health Partnerships breakout session. Glad to have you with us. We'll be talking today about tech partnerships and tech choices, speaking with some implementation groups and tech leads about successful strategies for partnering in technology selection in low resource settings. We'll specifically focus on ways that these partnerships can lead to lasting and sustainable infrastructure beyond the life of a given project. And I'm joined by a great panel that I will allow to kind of introduce themselves as each of them goes. We'll hear first from Nathan from Catholic Relief Services. We'll be followed by Pamod coming to us from the University of Colombo and with previously the Ministry of Health at Sri Lanka and the HISP Sri Lanka group. Then we'll hear from Juliet Todogu from eHealth Africa, and then from Scott Ruspatrick, who is with me here at the University of Oslo. I'm Mike Frost. Scott and I are both senior advisors here at the University of Oslo and product leads for parts of the DHIS2 software platform. So with that, I will turn some time over now to Nathan to talk us through who he is and the projects that he's working with. Thanks, Nathan.
Thanks, Mike. Pleasure to be here. I'm pleased to be part of this panel and offer sort of my experience and insight into this topic, a very interesting topic. First, about me. My name is Nate Barthel. I'm based out of near Washington, D.C. I do work for Catholic Relief Services. I'm actually in their IT department, but in their field-facing team, which we call ICT4D. And most relevant to this conversation, over the last several years, I've done a lot of work in the digital health space and specifically on digital mass campaigns, starting in 2017, supporting a project in Nigeria, which scaled up to a good portion of the country, then to Benin, and then now starting up in a number of other countries, Burkina Faso, coming up with a Mali later this year, Niger, potentially some other ones. But before I kind of get into this a little bit further, I think it would help if I described a little bit about digital mass campaigns, as it's kind of a new approach that CRS has been supporting in these countries I just mentioned. So digital mass campaigns, well, first of all, mass campaigns themselves are a common tool used to combat a number of diseases. The one that I've been supporting and focusing on mostly is malaria. And so a mass campaign is the distribution of something over the population. In Nigeria, we support the distribution of bed nets. In Benin, it's nets plus medications for children under 5, and also medications for river blindness. In other countries, it's going to be a combination of those. So basically, the process is blanketing a country or a portion of the country in these products. So if we take nets, for example, and covering maybe just even a state in Nigeria, it's a massive campaign with thousands of individuals who are mobilized to register the households across a given state. There might be a million or more households. And the process is registering, well, first there's training of the campaign staff, then there's registering of the households, and then there's give the households basically a little coupon with a QR code, at which point in the future, like 5 days later or so, they go and redeem those for a net. And what we've done is digitized that entire process so that the household registration is digitized, the training is digitized, the site selection of the distribution points is optimized. We capture who trained, who, where, all sorts of information, and even the payments themselves are also digitally transferred to the bank accounts. So it's a major undertaking. There's a significant software component, as you might imagine, mobile application dashboard and all of that. There's also massive logistics and operations efforts. There's trainings, just to give you an example. Okay, so in Nigeria, we might have 7,000 mobile devices to register households across a state over the course of 9 days. If you take that, each team is made of 2, so 2 people per device. So that's 14,000 people just for the registration that you have to train. So it's a massive, massive operation, a massive deployment of technology and supporting systems and processes to support that. So that's the background. That's what digital mass campaigns are. And I think it's important because we've been supporting this now in as I mentioned, a couple of different countries, and in fact, had different models. There's different models of partnerships with governments and with technology providers. In one model, we, in a sense, interface with the technology providers. We bring that to the table. We, in a sense, I want to say control it, but to a degree, control it. We are the ones who have the contracts with the vendor. We, go through the requirements gathering and do, implementation testing, all that kind of stuff. The other model that has been a newer model and very interesting is actually working through existing government systems that are already in place to support other health services within the country. And that's almost always DHIS2. And so I just kind of frame this up as two different models. They both have their pros and cons, and I'm not going to go into massive detail on that, but maybe just a point or two. One is the model where we bring our own technology is in some respects easier, right? We have control over the process. We have control over, the communication with the vendor. We have control over, where things are hosted and testing of the hosting services to make sure that they can handle the load of, 7,000 phones hitting it on day one like that. And are able to, in some respects, it's less risky from our point of view. With that said, the newer model that we've been working with, I think in some regards might be more longer term sustainable, because we're working through government teams that manage these systems, and perhaps they have relationship with other vendors to implement these digital systems. And one of the issues with the first model is that transfer of technology and capacities to the government is, it can be a difficult process. The second model, though, it's kind of built in from the start. So I feel like there's more risk at the beginning because we have less ability to control the variables. But I do have a sense that maybe over the longer term, that is a more sustainable model. So we can go into that in more details, but I thought it was helpful to give an overview of digital mass campaigns and kind of my experience supporting those and the different partnership models. Thanks, Mike.
Great. Thanks a lot, Nathan. Pamod, over to you.
Right. Hi, everyone. I'm Pamod from Sri Lanka. So I'm coming from a mixed background of medical, public health, and informatics. So I've been helping implementation of digital technologies in a few countries in Southeast Asia region for last 10 years. So today what I'm hoping to discuss briefly is based on a use case, so some experience around implementing digital health solutions for COVID-19 in Sri Lanka. So I have a few slides which I want to share. All right. Okay, so we might not realize that we have lived with the COVID-19 for almost 2 years now. It all started in late December 2019. And Sri Lanka, a country in the Southeast Asia region, which is heavily depending on tourism, got its first case of COVID-19 just 1 month after we heard about it in China. So we were able to establish a digital health system in Sri Lanka to track and to do some surveillance on COVID-19. Just before we got the first case, all this started with some brief discussions we had on 20th January in Ministry of Health. So there were a few points in this discussion we had just 1 week before we got this first case of COVID-19 in Sri Lanka. So a few points I have highlighted here. We didn't have any digital solution to do any surveillance on COVID-19 at that time in Sri Lanka. So ministry wanted a comprehensive system to engage with stakeholders, and that system had to be developed in a few days, and they didn't want to follow the usual government lengthy procurement processes. And none of us was certain about the requirements of this digital system, right? Because it was just a couple of weeks into the pandemic. So the system had to be kind of flexible to accompany, to accommodate various requirements of COVID-19 in time to come. And we had to start small, and it needed to be scale up. So after kind of rounds of discussions, the ministry decided to use a digital platform, DHIS2. Probably most of you are kind of familiar with this platform. It's a free and open source solution, which is used in more than 70 countries globally right now. So what happened was, like, over a period of 3 to 4 months, there were 9 modules that were developed by customizing the existing DHIS2 platform by the Ministry of Health, and of course, like, with help of and contributions from several stakeholders. And then whenever DHIS2 was not able to kind of fulfill requirements that they had, we were able to design, we call it modules, and a couple of integrations on top of DHIS2 platform. So this was not possible. I mean, we had to do some additional development on top of the platform. To do that, we organized a hackathon in Sri Lanka to get support from multiple stakeholders, including the private sector. So with all these contributions, we were able to create something called COVID-19 surveillance package for Sri Lanka, which was followed by a brief but fast rounds of trainings. We were able to put it into local use. The story didn't stop there. We shared this metadata package on DHIS2 with the University of Oslo, which is kind of coordinating the development of the platform, and the global DHIS2 open source community. So they were able to make a generic package based on experience from us as well as few other countries, and then share it with the globe so that other countries also could start working on, start using these packages. So as of now, this is kind of like the ecosystem of modules we have in this system. So as you can see here, we initially started with the ports of entry because in February 2020, that was the main requirements. But over time, we were able to make this kind of different modules on top of the platform. And in 2021, we used the same platform to do COVID immunization campaign. And also, you can see here onto the right side, we also use few other the digital public goods, such as, for example, the DIVOC, which is used in several countries in the world for issuing COVID vaccination certificates. So in this kind of integrated solutions, we were able to use DHIS2 as a central platform and create integrations with other DPGs as well as other platforms which are already used in the Ministry of Health. So there were barriers while doing this, like, for example, change in requirements based on the changing epidemiology of the disease. And then there were already a few systems that were emerging because everyone was very enthusiastic in designing systems around COVID-19. So we had to kind of manage these requirements as well as integrate when necessary, and to build capacity at different levels to use the system. I mean, just the core team developing systems without the end users using the system, I mean, it's not going to really scale. And so we had this challenge, and of course, engaging with multiple stakeholders within and outside of the Ministry of Health, and of course, infrastructure, because we had to reach the health facility level, as well as training end users amidst all these restrictions and limitations around conducting physical training programs. But there were a few success factors, like, for example, using DHIS2 as the core platform and trying to integrate other DPGs and digital public goods as well as existing solutions, and building custom applications as well as integrations whenever the core platform was kind of not capable of fulfilling some requirements. And long-term capacity building in health informatics we had in the country for a period of 10 years. It really helped out when we were trying to implement these systems in the COVID-19 pandemic. And of course, multi-sector engagement. So we got support from the Health Ministry and other ministries, the government ICT agency and the presidential office. So getting all of these stakeholders was a challenge, but it actually was a success factor why we were able to implement it in a very short span of time. And of course, we were working very closely with the DHIS2 community as well as the University of Oslo. So, I mean, we benefited with this community support as well as we contributed to this open source community. And the governance mechanisms, I mean, they were not so formal to start with, but we had it operational during the pandemic, which really contributed us in scaling this up as well as to sustain. So I will just stop there. We'll take up a few questions later. Thank you.
Thanks, Pramod. Thanks for sharing. That's a great experience for us to talk about in a moment. Juliet, I believe we'll turn time over to you.
Sure. Thanks, Mike. Hi, everyone. My name is Juliet Odogu, and I'm the Executive Director at eHealth Africa. Just by background, eHealth Africa is an NGO that works with the mission of supporting our country's government partners, as well as other key stakeholders, primarily in designing, developing, and implementing data-driven solutions that really help to improve the lives of underserved communities. We're currently working in Nigeria, as well as a number of other sub-Saharan African countries with the same mission. For the purposes of today's conversation, I will share some insights and lessons learned from our couple of years of working in supporting implementation of digital tools for development. I'll use a project case study and share some of the examples where we were able to see some of these lessons learned and just summarize the insights there. So as a quick background, eHealth Africa was called on at the start of the COVID-19 pandemic to provide technical support to the Nigeria Center for Disease Control in early 2020. And the goal here was really to help provide a suite of data-driven solutions that would address a number of gaps that the NCDC, as well as other partners, had previously identified, some of which were the lack of a digital commodity management solution at the central level of NCDC, which they would want to use to manage all of the incoming COVID-19 commodity donations, and also manage the downstream distribution to subnational levels. We were also brought in to support the deployment of a laboratory information management system at the National Reference Lab for the analysis of what was called the multiplex bead assay, one of the complex suite of assays that were being analyzed by that reference lab as part of their integrated national serosurveillance project. And lastly, during that time as well, we're also partnering with Resolve to Save Lives on a Data for Action project to improve early detection and response to potential disease outbreaks, at the time supporting 2 state public health emergency operations centers in improving their timeliness in case identification and action. So this was really the project context that we're working under within that time frame. And so some of the lessons that we learned, particularly around tech choices as well as partnerships and some of the things that really made our project successful, I will go into shortly. The first key lesson that we really learned from across board for deployment of these 3 solutions was, one, the critical need for a comprehensive needs assessment as well as stakeholder engagement. What we find is that oftentimes, especially in agile deployment projects, this needs assessment and stakeholder engagement phase is often overlooked, as most times tech partners as well as donors are laser focused on the solutions that we believe will seemingly address the challenges in question or the solutions that we have already in our suite of tools. However, from the stakeholder workshops that we conducted around all 3 solutions, revealed some really eye-opening information about the particular challenges that the beneficiaries had. Helped us to change our strategy by really focusing on what would meet the needs of the beneficiaries. This process also helped us to identify what we call stakeholder champions that were really helpful for long-term sustainability beyond the project implementation itself. And the needs assessment as well as stakeholder engagement helps us to gain overall buy-in and acceptance of our proposed solution. So, one of the things I strongly recommend from our years of implementation is really not skipping this sometimes grueling phase of needs assessments and stakeholder engagement and advocacy, because it really helps to ensure that we're developing solutions that are fit for purpose at the end of the day. Another key lesson that we've learned specifically from when we deployed the logistics management solution for the Nigeria Center for Disease Control was the need for integrated capacity building throughout the project lifecycle. Again, at that needs assessment phase, we're able to identify super users and teams within the NCDC who would be responsible for maintenance and would be instrumental in ensuring that we have continued utilization of the tools that we deployed. And so what we did was we incorporated capacity building for each of these groups at various stages of our deployment. So specifically, we trained the ICT unit within the NCDC on software upgrades, on ability to troubleshoot our custom solution. And we also included them at different stages of our development and deployment process so that they were well carried along and they could then turn around and be the first line of support within the larger organization for the solutions that we've developed. We also then trained the supply chain units on ability to do data inputs, data management, data visualization, and then also ensure ensured that they could additionally provide custom reports for other teams within the NCDC as well. And so by taking this integrated capacity building approach, we were able to seamlessly integrate our solution into the NCDC environment with a minimal learning curve for the teams involved. So we're actually currently in the process of migrating this solution to the NCDC hosting environment, and that we found that process to be extremely seamless because there's already a familiarity with the solution, and there's a willingness to adopt this and sustain it. The other thing too with technology development is that at eHealth Africa, we've adopted what we call an API first approach. With the awareness that we know that we operate in a complex technology environment, we make sure that we design our solutions with the ability for integration and interoperability wherever necessary. So specifically with the laboratory information management system that we deployed for the reference lab, we understood that the solution would be operating within a complex network of labs. And so we designed the solution with the flexibility to be able to share data with other lab systems within that network, and also with a central data storage system at the National Reference Lab. We also then built in flexibility to add in additional lab tests and lab assays on the existing system as the tool becomes utilized at full scale. So we think when we're developing, we think with the end solution in mind. We also think about other partners within the ecosystem that may want to integrate at a later stage into the solution that we've built. And then we ensure that we take care of all of those considerations at the very beginning of tool design and development. And then lastly, one of the challenges that we also find oftentimes as implementers of digital solutions is, and I'm sure everyone on this panel too will have faced this at one stage, is really the plethora of tools that we see at various points within the healthcare delivery ecosystem. And sometimes as implementers, we implement tools with very little consideration for the burden that it places on the last mile healthcare workers or the data officers who have to enter data into multiple tools and use multiple tools for their day-to-day healthcare delivery services. And this also then affects the overall system efficiency. And so one of our priorities in information systems deployment is ensuring alignments within the entire ecosystem and avoiding parallel systems as much as possible. And this is one of the critical lessons we've also learned from our experiences. A really good example of this is with the Data for Action project, which I also talked about, where eHealth Africa was called upon to build, a really nice dashboard to track timeliness of case identification for disease surveillance. So looking at, when an event is seen in the field and tracking how the surveillance officers are responding to those, to when they're confirmed as a case, and then to the actions that are taken on there, to really get the states to see that end-to-end timeline, and then see where there are gaps and improve on those timeliness metrics to improve overall surveillance at the state level. And when we started that project, and then we started going down the stakeholder engagement path and understanding the landscape, one of the things that we then discovered was the existence of a tool called SORMAS, which is a really robust surveillance tool that is in use by the Nigeria Center for Disease Control, which has a very, very robust case management module. And what we then found out is that this would essentially perform the same functions that we had sought out to empower the states with. And so, instead of building out our own fancy dashboard for the state to be able to manage the same issues, we instead pivoted our efforts and our resources into partnerships with the NCDC to ensure that we got the access to the SORMAS down to the state level, and then focus our investments on capacity building of these same state players to conduct better data analysis, to improve field-based data collection with additional mobile tools and USSD tools. But then really focusing on enabling utilization to the existing SORMAS data for effective decision-making. And so these are some of the ways that we were able to build stronger partnerships within the larger health ecosystem, see where there are gaps and where there are parallel systems, and really try to eliminate that, and then really also build for flexibility, for scalability, and partnerships in mind. So these are some few lessons that we've learned. I will pause here, and I know we'll talk about a few more insights that we've all learned so far, and then we can take it from there. Thank you.
Thanks, Juliet. That raised a lot of important points, I think, that we'll get back to in the discussion. Much appreciated. So now, Scott, we'll turn over to you.
Great. Yeah. Thanks, Mike. And thanks everyone for joining, and to my fellow presenters for a really great introduction. I'll try to build off some of your thoughts and ideas that you've introduced. I kind of wanted to take us to the perspective of an actual platform owner. I'm a DHIS2 analytics product manager, so I'm responsible for developing the roadmap and executing that roadmap for the functionalities in DHIS2 that are used for analytics, so dashboards, maps, charts, scorecards, pivot tables, these kind of things. Here at the University of Oslo, we have a relatively large software development team split into multiple product streams. And these product streams are responsible for coming together to build a coherent roadmap for the entire platform. And I think that it's interesting, maybe it's interesting to hear a little bit about how we think about partnership, because it's a little bit different than I think how people who are implementing various ICT for D solutions or even DHIS2 think about partnership. Here at the University of Oslo, I think many people use DHIS2. Many people work with companies that provide, or NGOs that provide DHIS2 as a service. Some of you may work for companies or NGOs that provide DHIS2 as a service. But very few of you probably actually work directly with the University of Oslo, and that's somewhat by design. We want you to be able to use DHIS2 without the engagement or the necessity to work directly with the core development team. We want you to be able to use the platform, to innovate on top of the platform, to configure the platform, own the platform locally, have it answer your needs, and only potentially get in contact with us if there is some horrible situation, or you have some features that you have some requests that are currently not met. But that means that we have direct contact with a very small minority, probably 5% or less, of actual DHIS2 implementations around the world. And we consider that somewhat a degree of success, because that means that the platform can be locally owned and used. But that being said, when we do get engaged with partnerships, it's kind of around two different fronts. The first one is that we need to, the first partnerships are to, if we're going to engage with a partner, for example, are becoming a collaborating center with the WHO, that partnership was developed to come up with global guidelines. So a lot of people are using DHIS2. A lot of people are using DHIS2 for the same thing: HIV surveillance, malaria surveillance, water sanitation monitoring, antenatal care, immunization monitoring. A lot of these same things in dozens of countries. And we work with WHO to come up, form a partnership with WHO to come up with kind of global guidance on how the best use of DHIS2 for these different programmatic areas are. And we even work with them to define predefined indicators, data elements, data sets, programs, all of the things you need in DHIS2 to actually be able to monitor these programs. And then, these are publicly available. We call them our metadata packages. And then we put them out, and anyone can grab these. Any country can use them. Of course, they have to modify them to their local context, but it's a partnership that means that allows us to benefit the most with a generic product, right? And the other partnerships that we get engaged with are more strategic edge case partnerships. So what we mean when we say strategic edge case partnerships, these are new domains for DHIS2 that will really stretch or push the software. For example, our engagement right now, increasing engagement with education management information systems. DHIS2 is being introduced in a handful of countries as their central education management information system. Our continued engagement in logistics and partnerships with other logistics systems to cover that use case, and our increasingly growing partnership with like WorldPop, Grid3, Google Earth Engine to be able to bring in much more complex population data. So these kinds of edge cases they stretch DHIS2's capacity, functionality, and that means, and then we develop new functionality to support those edge cases. A lot of times it also tells us where we don't want DHIS2 to go, to explore these what we call these edge cases, these strategic partnerships in these kind of frontier domains. For example, we know for certain that we don't want DHIS2 to become a warehouse management information system. Don't use it for that. Some people are, but we don't recommend you do it because it doesn't have the database model to support that. But only by engaging in the LMIS domain and working with the other platforms that operate in that space, we're able to appreciate, no, this is where DHIS2 stops in this space, and other platforms and other systems need to begin. The last point that I want to make is kind of around what we consider kind of the products of our partnerships are. The first one I mentioned was kind of the metadata packages, or these kind of generic pre-configured guidance or DHIS2 instances that anyone can use. The other one, and Pamod touched on this, is new technology. And new technology can kind of come in two different ways. The first one is we have been working for several years to make DHIS2 an application-based platform, just like you have with like Google Android or iOS operating system, where anyone can make an application for DHIS2. And Pamod was use case as an example of that, where they were able to make multiple applications for DHIS2 to cover their COVID-19 use case. Now, these local applications don't have to just be local. And Pamod mentioned this as well, that many of these applications that are made to satisfy a local need are then shared through our app hub, through our community practice, and made available globally. So we have situations where, Uganda uses applications made in Sri Lanka. South Africa uses applications made in Vietnam, and these applications can be, just because they're made locally, they can still be made generically and then shared globally. And that's where we're seeing the most innovation within DHIS2 is local applications and local partnerships, south to south collaborations. And the core, what we're doing is just facilitating that. We're making sure that they have the development tools, the software resources, libraries, what we call technical boundary resources to be able to make these applications and then share them globally. The other is around, from a technical perspective for partnerships, is integrations and interoperability with other software platforms. Now, I think everyone throws around interoperability and integration like it's some kind of silver bullet, but I can assure you from a software perspective, it's extremely difficult. And so what we do on DHIS2 is we maintain the interoperability standards that means systems can talk to each other. Now, of course, these standards have to be reciprocated on the other software side, but it means that we maintain the open API so that if other systems want to connect with DHIS2, there's a technical pathway to do that on the DHIS2 side. But that being said, we know that we're not an integration platform. DHIS2 is not an interoperability layer by nature, what it is. There are other systems like OpenFN, OpenHIM that are interoperability layers, and we try to work with those to make sure that if people do need to connect with DHIS2, that they're able to use these other interoperability layers to get their data, push or pull data into and out of DHIS2. So hopefully maybe that illuminates some perspective from a platform provider, but I'll hand it back over to Mike and have a little bit of discussion, I guess.
Oh, thanks, Scott, and thanks to all the panelists for bringing up such important and interesting topics. We did try to kind of have different perspectives here on the panel, coming from local-based NGOs, regional kind of network NGOs, traditional NGO based there in the US, and a technology provider. You can hopefully see from these presentations that the concept of partnering and also working through what are the appropriate technologies differs a bit depending on what role you're playing and where you are. So it's a complex ecosystem that really drives the development, adoption, and use of these digital solutions, ultimately to get at the health goals that we're all very interested in supporting. So we'll invite you all to put questions into the chat. We'll try to be responsive to those, but we also have some questions designed to further this conversation a bit more. So I was going to start out, Juliet, with a question to you. You talked a lot about kind of carefully thinking through the problem and doing design ahead of time, not skipping some of these important steps, and also had mentioned about your concerns for the burden that gets placed on the last mile health workers. I'm just curious with your perspective about how to address some of those things, particularly working with ministries of health. What do you think makes for success in those kinds of partnerships? And does a partnership with the Ministry of Health help you get at kind of these concerns around careful design and not building a lot of parallel systems, et cetera?
Thanks, Mike. So I'll answer the second part of that question first, and then go into detail, because I do think that a partnership with ministries of health, the agencies, as well as the beneficiaries, right? So, or representative of beneficiaries, is paramount to ensuring that we're designing and deploying fit for purpose technologies or digital solutions. Again, as technology providers, a lot of times we all, we're very innovative. We already have solutions in mind. We want to put forward the latest cutting edge technology. So we have a lot of design labs. So we create a lot of really cool stuff. But then when we look at the local context where we're trying to deploy our solutions, it is very critical that we have buy-in and support from what I would call the custodians, and the custodians of that environment or community, which usually tend to be your government partners, or even stakeholders that have been in that space for a long time, as well as even when you go down to the subnational and local levels, the community leaders who really understand the challenges. And so, that initial engagement of the ministries and those agents really makes for a successful partnership. And when we do those kinds of conversations, there really has to be what I would call mutual trust between both of those parties. So one coming there with the perspective of trying to meet their needs, as opposed to trying to push down a solution down anyone's throat. And I think because that really helps in making sure, again, that we're designing fit for purpose technology. So coming with the mutual trust approach, making sure that they're able to share their solutions with you. And then we're able to do what I call co-designing, right? So having the design process with the ministries really helps. And then I think that, just making sure that when we have these kinds of technology solutions, we are considering other factors such as like the infrastructure in which we're going to deploy them, the local context as well. All of these factors play a role in ensuring that we have strong partnerships with the ministries. They're able to trust the solutions that we're bringing into play because they know that we've done the appropriate research and that we're designing solutions that have low infrastructural burdens. Again, like I said, takes into account the burden at the last mile as well, and then also takes into account things like sustainability and total cost of ownership. So when we bring in solutions where we then expect the ministries to foot the bill for really high-tech solutions that require high connectivity, monthly upgrades and things like that, those start to diminish the trust that we have with the ministries and our partners. So we really have to think about the end users. We have to think about the infrastructure, and we have to think about the last mile as well, and then make sure that we have that mutual trust with the ministries and the partners that we're working with to ensure that we have a successful deployment.
Yeah, great. Thanks, Juliet. I have just one follow-up on that, that Juliet or anybody else can jump in on. Just you've mentioned, of course, designing together and working closely with the custodians and making sure you understand the context. We discussed that a lot in the ICT4D space. I'm just curious if anybody wants to voice a little bit about how to do that. What does it look like to actually design together? And what are some of the steps or activities that are required in order to do that successfully? If anybody wants to jump in on that.
Yeah, probably I can give some input. So again, coming from the context, local context in Sri Lanka, what really happened there? Getting the stakeholders involved. So the thing is so one good thing that you have to do is the requirements, when we are going to implement a technology solution, these requirements has to be clear and it has to be communicated with all the stakeholders involved, so that we all know that, for example, the Ministry of Health cannot design systems by themselves. So in most of the countries, you have the government. So probably that's like a central ICT entity who's kind of helping out all the ministries. And you probably have the private sector and you may have other NGOs. So probably you need to have some kind of a forum. If it is not there, it's not so difficult to create. Sri Lanka didn't have it, but for some reason, probably because of the COVID, it was a kind of a disruptor, but we were able to establish it. So that way, ministry knew what they could do. And for example, as we were able to know, so we knew we can only develop, probably customize DHIS2. So there we identified that there were some requirements which are kind of beyond the scope of this platform, where we required some other solutions. So this is when the central ICT agency kind of chipped in, and they said we will coordinate these activities by communicating with the private sector and volunteer developers, and then the outside the global context. So this kind of mechanism has to be there. So it's more about governance, but probably if you don't have a proper governance mechanism at the moment, I mean, you can start from something briefly, but then you just need to get all the stakeholders engaged. It sounds complicated, but if you start small, I think it's not something like very difficult to attain. Over.
Great. Thanks, Pamod. And I was actually going to come to you next anyway, so let's continue with you. So because, of course, we have a collaborative relationship between the University of Oslo and your group in Sri Lanka, I think I can ask you the hard question here of why did you go with DHIS2 if you knew it didn't cover your needs? Why did you make the decision to customize? And maybe more broadly than that, how can you tell that when a technology isn't fit for purpose, and kind of what makes you, how do you handle that if you're feeling pressured by the local custodians perhaps or the donors to use a particular solution?
Yeah, it's a kind of a tough question. So it's like this, like, one thing we have to understand is like, we need to have a very good understanding about the local context in which that we are operating. So in the context of Sri Lanka or any other country in that sense, like, it's kind of fashionable for the stakeholders to come up with a solution. So let's try to introduce this digital technology, like whenever they encounter a complicated problem. But the thing is, like, for example, one basic thing for all these technologies to work is like, we need to have infrastructure. Infrastructure is kind of the railings on which the platforms are implemented. So if you are trying to like even implement a digital solution, we have to decide up to which level. Like if you are going to kind of reach the grassroots level, and if the infrastructure is not there, it's definitely going to fail. So you have to know that beforehand. And then again, like, you need to have these facilitating conditions, like you need to know like whether you have the local capacity at all levels where you want to implement the system, and whether you have enough time to do like capacity building and probably develop software. So again, like why we selected DHIS2 was like, based on that situation, we didn't have time to develop something new. So we again kind of leveraged on the existing local capacity. We were using DHIS2 for some other work, and our field health workers were quite familiar with it. So that really helps. And also, like, sometimes like people try to introduce digital solutions like to overcome the inherent governance issues that are there in the system. So for example, if you don't have proper information workflows, proper monitoring and evaluation mechanisms in place, if you just try to introduce, say, for example, DHIS2, it will not solve the problem. So that's then a governance issue. So this way you need to understand like what are the issues in your local context. So that way you can kind of really figure out that this is not going to work. And one more thing to add is like, more than like how to apply DHIS2, we really need to know like what DHIS2 is not capable of. So in our example, like what we really knew was like, we knew like we can't do the contact mapping, the contact tracing visualizations in DHIS2. So we knew this from the day one. So this is where we tried to engage other stakeholders to design these components. And then for the kind of second part of your question, like the thing is like most of, especially in the LMIs, low and middle income country context, these decisions are kind of political. So the thing is like, you have to be very open with all the stakeholders. So here, the long-term relationships with the ministries and other stakeholders really help, so that probably this trust mechanisms that work with the ministries and the NGOs or whoever who's operating really helps. And then, of course, like it's always good to have these documents, which is kind of not practical in most of the cases. But if you have this document about like, these are the things we are going to do, it always helps us so that we can always communicate. And one final thing to add to this is like, they always ask like, will DHIS2 work? So one good thing with DHIS2 is that you have this network. So you can always show examples from different countries. Like you can quote like, in this country, this solution worked when applied like this, but in this country it failed. So if you have that example, they can, even from the political pressure, you can always kind of counteract, like if you can provide them evidence. So it's more to do with the trust and kind of the relationship. And of course you have this, the network and all the connections. So it's a kind of a complicated thing, but that's how it works, unfortunately. Over.
Great. Thanks, Pamod. Thanks for indulging my question there. And I just wanted to point out to the panelists, there are questions coming in on the chat, both the chat and the Q&A. So as you have a colleague here speaking, feel free to jump in and respond to some of those. We'll try to get to those also as much as we can by the end. But next I was going to come to you, Nathan. The NGO cycle of delivering digital solutions and working with local countries is driven very much on a project kind of basis. And that at times is at tension with our goals in the ICT for the community of leaving something lasting and leaving something sustainable. And I know CRS, you've had a lot of opportunities working with ministries, you've had varying kinds of partnership models. I'm just curious what you think of as kind of the best practices to try to ensure that even though the funding may be coming through on a project cycle, how do you try to ensure that what you're contributing to builds local infrastructure and lasts beyond the life of those projects?
Yeah, thanks, Mike. It's a tough question. I would say, coming from my perspective and experience, I haven't always been successful here, to be frank. But I will say a couple of things that I think are important that need to be in place to even begin to explore, the solutions living beyond the project. First, I think, I'll speak from the perspective of the INGO working with a government. The government has to see value in the solution. It can't be something that's hoisted upon them, but something that they feel a part of and value and have commitment and interest to using it beyond the life of the project and perhaps for other things. So for example, if we have a large digital campaign and we've invested in buying, thousands of phones, what else can we use them for? Other campaigns, other health activities, maybe things outside of health even. So there has to be interest, I think, first and foremost. Clearly, there needs to be engagement early on and thinking about a capacity transfer plan. With any technology solution, there are a lot of activities. I think people tend to focus on the application itself, but there's so many pieces around that, particularly with large deployments of technologies, the support model, logistics, engaging with a vendor, hosting, you go on and on. So some of these pieces can begin to be transferred over to the governments to say, okay, you're responsible now for training, or you're responsible now for engaging with the vendor, or you're responsible now for logistics. So that's something to think about. It's really early on is engaging about what is that transfer model. Funding, a big technology system can't live without funding. So it has to be there. So, it's gonna cost money one way or another to support a platform. So I think this gets back to the value and interest from the government. They have to see that value and be willing to either seek additional funding or fund it directly themselves. But that's obviously critical. And maybe just the last point, I think one of the biggest barriers I've seen to that transfer of systems and solutions to governments is an underinvestment on, again, in my limited experience, underinvestment in the people to manage those systems with all the different components. So often I would find it's maybe one person who's responsible for the ICT for D, but these systems often take many different people. You have the trainers, you have the people who are maintaining the platform, you have people who are doing the device configuration, you might have some overall IT project manager. So there really needs to be a capacity to absorb all of these different functions, and that needs to be in place, or else it's kind of, it's not really going to go anywhere. So maybe just those 4 points. But thanks for the question.
Yeah, thanks a lot. There's a lot to unpack there. I'm sure we could have multiple panels just on this particular question, but it's a challenging thing and worth keeping in mind as all of us are trying to support kind of these same goals of lasting change and something that can really roll forward. Okay, Scott, I'm going to throw you a bit of a curveball. Rather than the question I was originally going to ask you, I wanted to point you to one of the questions that came in through the chat here from Rowena. asking about the types of technology partners and partnerships which have created the most value for your platform and mine, DHIS2, and complementary technologies that pair well with DHIS2 deployments.
Right. Yeah. Thanks for the curveball. I was actually like typing an essay to her in the chat, so I saved myself some effort here. Right. So to be completely honest with everyone, I think the biggest partnership that has benefit, I think I can think of two. The first one is our partnership with the WHO, becoming a WHO collaborating center, and getting closer access to all of the experts and guidance and resources that the WHO can bring to a platform that has the scale of DHIS2. There has been a lot of reinventing the wheel out there. Within DHIS2 community itself, of course, we see pilotitis is a well-known, understood phenomena in the space, but even just within DHIS2 deployments, there's some pilotitis, there's some reinventing the wheel. And our partnership with the WHO gave us the platform to be able to come up with some standards or galvanize around some standards that I think have really borne a lot of fruit at this point. The other partnership I would say is actually not on the DHIS2 technology itself. It's our partnership with some of the original founders of ODK, actually, who have a side company supporting Discord. And we actually use Discord as our community of practice platform. They host it for us, actually, y'all is the host. And having the community of practice for us, which allows anyone who's doing anything with DHIS2 to say anything they want about DHIS2. It also, we have staff whose full-time job is there to moderate the community practice, answer questions, people post solutions, people post problems, people post insights, people link their apps. We have user stories. Just that community, building that digital community has been able to have spur so many connections and has it's incredible the network effects that come out of having the community of practice and the partnerships that it brings. Again, a lot of things happen in the community of practice that the University of Oslo is not even directly involved with, but we are facilitating that environment to happen, which is fantastic. I think, specifically in the second part of your question is what complementary technologies pair well with DHIS2. Maybe Mike, you could come in on some of these as well, but I would say, as we've started to appreciate where DHIS2, it's not well suited from a technical perspective, and that we will not go in that direction to make it well suited for that technical question. I can mention just a couple of things really quickly. Upstream supply chain systems, like I mentioned earlier, warehouse management systems, routing, fleet optimization systems, payment systems, ERPs. DHIS2 is not going to be these systems, and countries need these upstream logistics systems. Now, what we try to make sure is DHIS2 can be the point of data capture at the lowest levels, but DHIS2 is not going to be able to manage your supply chain warehouse. And countries need these systems. Most of these systems cost money, but we have partnered with several of them, like Medexus, mSupply, that do provide these services, that are either open source or becoming open source, that are also public goods, that we try to form more closer collaboration and integration with. Another one might be human resource systems. So many countries use DHIS2 for human resource monitoring to some extent, but a full-blown HR system is unique functionalities and requirements unto itself that the DHIS2 doesn't fully cover. What else? Probably there are some better tools for messaging services than DHIS2. DHIS2 doesn't incorporate Facebook or WhatsApp messaging, and so there is integration with some other platforms that like RapidPro that do provide that service. Mike, did you want to?
Yeah, sure. I mean, there's a lot we could talk about on this. In fact, I was going to kind of open it back up to the panel here on the topic of interoperability and see if anybody wanted to jump in. Just to say that this is one of the values that, at least as a platform from DHIS2, we see as being very important. We want the systems to be locally relevant, and we want them to be able to integrate into whatever is already there that is working. And so as a platform, we try to do this as best we can, and we have kind of a roadmap for interoperability. But throwing it back to the panel, I'd like to hear about any lessons that you all have about interoperability and what are kind of success factors that make that actually work. From our perspective, a lot of it is happening actually in the implementations rather than up at the kind of, donor level, high level conversations, but really on the ground, you have a specific system you need to integrate with. What are some success factors that go into making that actually happen? So I open that up to anybody on the panel.
I can take a stab at this. It may be just a sort of a thought on interoperability. Whenever I hear that word, I get nervous. And I think that's one of the biggest issues with that is what exactly do we mean and what are the expectations on each side when we say interoperable? There's a whole spectrum of interoperability, and we need to define what it is. So if the Ministry of Health says, oh, we want this system to be interoperable with our system, okay, what does that mean exactly? What types of data needs to be transferred? What formats? And need to get on the same page, because that can be a very difficult conversation. So I just want to say that I think we can't skip past the fact that people have different understandings and expectations and assumptions about what that means. Thanks.
Thanks, Dathan. That's a great point, and one that we often make ourselves here at the DHIS2 side, that interoperability isn't a goal in and of itself. We do things that are interoperable because there's something you're trying to achieve. So very important to figure out what it is you're trying to achieve before you get too far down the path of trying to do a very complicated technical solution. Thoughts from anybody else on this, on how to enable interoperability successfully, partnering around interoperability, or really with just 3 or 4 minutes left, anything else that you'd like to share?
I will also briefly add something to this interoperability integration. So, but I will talk more about integration in DHIS2, and I really like the point you highlighted about what is relevant to the local context. So one example is with COVID-19 vaccination was like the requirement of producing vaccine certificates. So like if you refer the DHIS2 community of practice, like there are so many solutions that countries have tried and they are working for them. So that means like, most of these solutions are not really, inherent components of DHIS2, meaning like these are custom developments or kind of integrations with other platforms. But because there are so many solutions that are available for different countries, and like for most of the countries, they have selected the solution that really works for them. That means like you can't kind of recommend one platform for, say, for example, for COVID vaccination certificates, DHIS2 is only going to work with this platform. So that doesn't really work. So that decision, I think, is based on the local context. So for example, in Sri Lanka, like we are trying with the DVOC as a kind of integration, but for that, of course, we get a lot of support from the government ICT agencies. So they are the people who are kind of managing the hosting part as well as attending to the technicalities of the DVOC platform. And we kind of created the integration with the DHIS2, and we support it from that angle. So it's a kind of a collaboration that really works. So you have to think of a technology level integration and collaboration, as well as collaboration of partners, which is kind of really suited to the local context. So that's the kind of mix that where the integration can really work. So wherever you have this mix working well, irrespective of the platform, I think that's how you should achieve the integrations and interoperability.
Great, thanks a lot, Pamod.
Yeah.
Mike, can I just quickly add
Yes.
just perspective, because I agree with Nathan about defining what interoperability means, but then also realizing that technology integration or interoperability really has to follow the process integration or interoperability, right? So when we look at how processes along, say, a supply chain, for example, interact with each other, then we start to see where are the technology connectivities between these processes and how do we optimize them, and that's where we start having conversations around interoperability. So I think that we should first have a process conversation, a data sharing conversation first, and visibility conversation across the entire continuum of care or program before we then dive into the conversation of how the tools need to speak to each other, or where interoperability needs to come into play. Because then sometimes you find that what you actually want is data sharing, right, or availability of data at a different administrative level, at the national level, or you want to see data in another system, and then that's a completely different approach versus trying to build out complex interoperability or integration between two solutions, whereas where you really wanted is data sharing. So I think that the technology conversation really needs to follow the process conversation before we go further.
Yeah, I agree completely. Thanks for that. And we're gonna let that be the final word here. We're just out of time, but wanted to thank Juliet, Nathan, Pamod, and Scott for being a part of the panel. And hopefully this was useful to the rest of you. And good luck with the rest of the conference. Thank you.
Thanks very much.
Bye.
Bye.
Thank you, guys. Bye.